Yes, these pathways underlie the strong link of obesity to endometrial cancer development. Previous large prospective epidemiological studies have shown that higher circulating insulin levels, higher circulating estrogen levels in postmenopausal women contribute to endometrial cancer risk. In addition, previous studies have indicated that, interestingly, higher circulating levels of IGF-1 appear to be protective. While this would seem to be a biologically logical approach to treating endometrial cancer, actually, the Gynecologic Oncology Group, our national cooperative group for clinical trials, has conducted such a study of metformin in advanced and recurrent endometrial cancer, showing limited activity of metformin for the treatment of endometrial cancer as a single agent. However, correlative studies are ongoing to determine if there might be a subset of patients who would benefit from metformin. Yes, so there are a multitude of ways of targeting these pathways, both at the receptor level, at the intracellular signaling levels, and downstream convergent pathways that regulate the cell cycle to control cell proliferation. Some of the promising ways we actually can look at what has been done to some extent in breast cancer for endocrine therapy. So, one of the recent advances in breast cancer include combining estrogen targeting agents such as aromatase inhibitors or estrogen receptor degraders, including fulvestrant, with cyclin-dependent kinase 4 and 6 inhibitors. So, estradiol and insulin signaling both lead to cyclin deactivation, which can activate cyclin-dependent kinases, increasing cellular proliferation. We hope to continue to evaluate some of these novel combinations in endometrial cancer treatment. These pathways have been previously implicated in the development of endometrial cancer, but their role in endometrial cancer recurrence was not known. In our study, we looked at a large prospective cohort of patients who were followed for recurrence after diagnosis. These patients received standard of care treatment, and we found that higher levels of circulating estradiol and higher levels of circulating insulin were independent risk factors for recurrence of endometrial cancer. We also found that looking at the tissue levels of receptor activation of the insulin receptor and IGF-1 receptor were also predictive of recurrence. These findings suggest that we should prioritize targeting these pathways to prevent or treat endometrial cancer recurrence.